Hello, welcome back, wonderful technologists. Welcome back to the podcast. Hope you guys are having an awesome week. So, in today's episode, what I wanted to do is do a little CT training reality check. Now, I know I've talked about this in my prior podcast episodes about, your CT training being adequate. It's probably one of the very first episodes that I've put out on this podcast. So if you're new to this podcast, you need to go listen to that episode. Mind you, I will link it in the show notes here so you can listen to that episode. And I want you to really think about your CT training, how you acquire knowledge throughout the years of your training, or if you're just starting out, wherever you are in your CT journey. I want you to kind of paint that picture and take a look at that and see, okay, am I really where I'm supposed to be at? Do I need more education and training? The people who were training me, were they good enough to give me the information that I needed, or basically telling me what buttons to push? So that is going to be the focus for today's podcast. So, what I mean by a reality check is we really need to hone in on the message on how to properly train the technologists that are coming into our department. Because as we know, the common trend that has been happening lately is that we are seeing a lot of multi-modality techs like CT slash MR, CT slash IR, X-ray slash CT. You're starting to see a lot of that because a lot of different facilities are just kind of chopping down and saying, okay, well, we can pay one tech to do two modalities, especially if it's a clinic or a smaller hospital or even at a bigger facility. I'm starting to see kind of like that, where you would have one tech that does two modalities. So, what we really need to think about is the training that we receive as technologists, how we were thrown out there when we were scanning patients, when we were learning. How does that look to you? So, the reality check that I'm going to give you, technologists that are listening to this episode, and I encourage you to listen to the very first episode about your CT training being adequate, because these two episodes kind of tie together. The thing is that we have to look at the reality of how we are training technologists now, how they're coming, into the department, whether it's through, school, they're going to CT schools or different programs, or if we're cross training them on the job, because I know now that's starting to come back. So we have to look at what kind of guidelines and what kind of format or framework are we giving these technologists to follow. Now, when I say about framework and just guidelines, do they know where the policy and procedures are? Do they know where to find contrast, where to find sheets, where to find syringes, where to find oral contrast, where to find IV start supplies? Those are the things that kind of pop into my head when I was starting out 20 years ago. I mean, this is coming on to my 21 years of scanning, that I wish somebody would have just had like a guideline or a framework to say, okay, this is where we're going to start. Because as a new technologist, you have to know where everything is. You do. You have to know where everything is. You have to know where to look for it, because those are the most crucial things, because you need to know where contrast is. You need to know where oral contrast is, right? You need to know where syringes are so you can fill up that IV contrast, right? Those saline bags that we use, IV start kits, because at a lot of different institutions, we have to start our own IVs. Those are the things that you have to know. And I wish that somebody would have given me those tools. That's why I'm so heavy on making sure that my programs and my resources and the things that I put out for you technologists is so that you know and that you can learn and take that framework and apply it to when you're on that floor scanning. So that is probably where we need to start, is to make sure that they know where all the supplies and everything is to do the job. And of course, the second thing is how do you operate the CT scanner? A lot of times we get x-ray techs that are cross-training, and guess what? They have never looked at a CT scan. They don't know what they're looking at. They're not so familiar with the cross-sectional anatomy like we are. It's different when you have an MRI tech that knows cross-sectional anatomy and needs to learn CT because they have to do both jobs. Very, very different, right? So that's the other piece. That's the second part of the framework that really needs to be honed in, is making sure that they know which buttons go up and down, in and out, and all that it entails when it comes to scanning. How to put the patient on there, how to isocenter, how to use the laser light, how to hook up the patient to contrast, exactly how to fill it up. When you're behind the console, what is the correct protocol for the orders that you have on your patient, and making sure you select the correct protocol so you have the appropriate recons, you have the appropriate scan, and that you're able to execute any 3D by thin slice reconstruction, whatever the case is, right? Those things are super important, and it's the second step that really every new technologist really needs to know. Even somebody who's seasoned, that's like an MRI tech, they need to know that because they're coming from MRI. That dynamic is a lot different than it is in CT. Like in CT, we're freaking go-getters. Like shit is always popping when it comes to CT. That's why it's the most heavily ordered modality, because doctors can't really make a decision without the scan. We all know that. And that is no hate to any doctors, but it's 100% true. And statistics will back that up, because the statistics keep going up every year as far as how many scans are ordered by emergency room departments, by physicians in clinics. CT dominates pretty much everything. So the third thing is to make sure that when you are training and educating a new CT technologist or somebody that's coming into your facility that is brand new to that facility, you also have to make sure that they understand, when they're scanning a specific protocol, why we do the things we do. Okay. You have to make sure that they're comfortable scanning, and to make sure that they know why we execute different things the way we do. Not this bullshit. You press this button, this button, this button, this button, and you just go from here to here. No. Okay. I can tell you, as a technologist with a lot of experience, that freaking just it really grinds my gears when I have technologists who are the quote unquote button pushers. Okay. That is so frustrating, because they are there to learn, and some of them really want to learn so they can do the job correctly. So why not teach them how to do the job correctly? I can tell you why that is. Because the technologist that is teaching these newer ones probably didn't have the education or the proper training that they desired or needed from whoever was training them. And that is a very common problem. It is a super common problem that we see in the industry, and it's been there for years. So I'm trying to break that generational curse and that stigma that we can do a better job. We can actually tell them the why, the reason why we're, starting here and ending here, what anatomy needs to be covered, because of whatever clinical diagnosis the physician wants. That is super important to not only educate them and train them the right way. And I'm very passionate about it because I like to see good technologists. I really do. Like, nothing makes me happier when I work alongside a technologist that can freaking execute an awesome exam. They've got killer freaking patient care skills and can do the job. And we can just run that department and just run it and just get shit done. Okay. Nothing makes me happier than that, because you are who you work with. Okay. So when you have a good team of technologists, I'm telling you, the department runs smooth. And when you communicate with each other, it runs smoothly. But we also have a group of technologists that were not trained properly, don't have the good educational skills, and are, I'm sorry to say it, but the typical button pushers. We can't have that. Okay. There's an opportunity to be better and to learn and to really get out of that mindset. Now, I'm telling you, for some old school technologists that have been in the business probably more than 30 years and that's all they know, sometimes you can't teach an old dog new tricks. Okay. But for some of these younger folks that are coming in, and even some of those seasoned folks that say, I really didn't know you can do it a different way. Can you show me? Absolutely. Because that is what it's all about. We don't gatekeep information, we share knowledge. And that's what it's all about. Okay. I know I was very fired up in this episode, but the thing is that CT education and training is not up to par. And that's why I am passionate to make sure that I give you the resources and give you the courses and give you the things so you can. Okay. So make sure you check out my courses. Okay. And get in there, learn some shit. Okay. Because I encourage you to learn some shit because that's how I roll. Okay. I put out some really good stuff. I have a couple of courses. I even have one for CE credits. I do have an ebook and a PDF guide. I even dropped a private podcast episode where it's 10 episodes. You also get a PDF guide on that as well. So that just talks about all the things I talk about CT as far as training and just getting up to par. I also am launching a mentoring and coaching program for CT technologists. So if you're interested, check out the show notes. There's a link. You can read all about it. Okay. Because coaching and mentoring, that is something that is needed. I wish I would have had a coach and a mentor 21 years ago. I think I would probably be a little bit further in my career. Not that I don't have successes, because I do. And I'm very grateful to be working in this modality and very grateful to do the things that I do, especially with this podcast and teaching courses. So make sure you check out the show notes. Follow me on Instagram. Follow on TikTok because I dropped the TikTok channel. So make sure you do that too. So love to hear stories. So send me an email if you have an interesting CT story. I would love to hear it. If you want to come on and be a guest on the podcast, hey, shoot me a DM. I will also link an application so you can fill it out. Come on the podcast and be a guest. So I appreciate all of you listening to this episode. It means the world to me to make sure that I just give you the knowledge and information because I have a lot of it. So hope you guys have a wonderful week, and I will chat with you next week.